Hello, Brainiacs. Welcome back to Brainwashed. I am your girl, Brandi J. It has been a long hiatus, and we're back in action. So, one thing that was on my heart during the hiatus, quarantine is still a thing, social injustice is still a thing, the world is still in disarray. Many parents are still acting as teachers to their children that they have decided that they didn't think it was the best idea to go back to school physically, whereas some people have chosen to do that because maybe that is what's best for their family at the time. So back when I started Brainwashed in April, I asked on Instagram, what content do you guys want to hear about, learn about, see? And someone mentioned, how do we tell if kids are suffering from a mental disorder or illness versus, oh, that kid just needs good parenting? Is my kid bad, or do they have a mental illness that I need to look into and get help for? So that's what today is going to look like. I'm going to highlight 3 very common overly diagnosed / misdiagnosed disorders or illnesses that we see a lot in children and teens, but sometimes we don't have the education piece to figure out what's going on, or your kid may be withdrawn or isolative. They isolate a lot and try to figure out what is really going on in your child's life, and you just cannot, for the life of you, figure it out. Bring up certain symptoms to the pediatrician, and they are maybe stumped sometimes. Usually they'll do a depression screening right there in the office. I'm not really sure about anxiety testing. Sorry, not anxiety, ADHD. I'm not sure how pediatricians handle that, but usually they try to rule out or say, hey, this is what it's not, so that we can narrow the things down that could be. So, parents, grandparents, caregivers, guardians, everybody involved in a child's upbringing. If you are seeing, there's a lot of things you could see. So I'm just gonna start with depression. Let me back up a little bit. So the 3 diagnoses that are overlooked or presumed as bad are attention deficit hyperactivity disorder, ADHD, depression, and anxiety. And that is because those 3 diagnoses, especially in children mostly, the symptomology or the symptoms or the behaviors exhibited in children are almost identical, and it's really hard to differentiate between those 3. So the goal here is to just educate, bring self-awareness, shed light on however you decide to soak in this information. I am going to go through signs of children at different stages in development, signs of stress of children and the different developmental stages. This information comes from a curriculum. I occasionally teach a co-parenting class for one of my jobs, but in my experience, rather, people have found this information insightful. Okay, so signs of stress in children, infants and toddlers. Regression in terms of sleeping, toilet training, or eating. Slowing down in the mastery of new skills. So babbling, cooing, crawling, who's turning over, sitting up, those kinds of things. For toddlers, maybe language skills, vocabulary skills, when they slow down in the mastery of new skills, that is a sign of stress. Sleep disturbances, which means difficulty going to sleep, or frequent waking during the night. Some of these things are common, yes. However, when they become excessive, that is when we know our children are stressed out. Here's the difference. The excessive frequent waking. Because, when we're sleep training a baby, obviously they wake up a lot during the night. Anywho, that's not the topic of discussion. Let's continue. General crankiness, temper tantrums, excessive crying. Obviously, infants and toddlers cry. That is their primary form of communication because they have yet to build a vocabulary. Slower or stalled development, which kind of speaks to the very first thing that I mentioned. Increased fears, especially of strangers. Toddlers are typically, hi, speaking to people, waving to people in the grocery store or somewhere public. So if they kind of retreat and be extra clingy, then that's one of the reasons. Depression and panic. It's really hard to diagnose depression in an infant or a toddler, but it does exist. Extreme need for physical affection and holding. So those are just some of the signs. 3 to 5 years, same as above. Excessive clinging, whining, sadness, or hypervigilance. Hypervigilance just means like super aware of your surroundings and like almost paranoid. Yeah, that's the best way I can explain hypervigilance. Aggression, or the opposite, being too good or just on their best behavior, making sure that their caregivers, parents, guardians, whomever, doesn't have a reason to be upset with them because that makes them anxious. They may have somatic symptoms. Somatic symptoms is essentially stomach aches, headaches, anything body related. Soma is the root word of somatic. Soma means body. So anything body related that children complain about after something that is stressful has happened. Maybe you moved, maybe there's news of a divorce, or maybe something that is stress inducing. Yes. So those are just some things that our older toddlers and preschool age kids may experience. 6 to 8 years old. Problems with impulse control. Now that can be at any age, but it's usually really rampant during 6 to 8 years old. Anger and aggression, fear of failure, hyperactivity or withdrawal, depression, clinging and whining, regressive behavior or baby-like behavior. So a 6 to 8 year olds don't really, or developmentally shouldn't be doing a lot of excessive whining. They have a decent vocabulary to be able to express things well enough to get the point across. I'm sad, I'm upset, so-and-so, hurt my feelings, that kind of thing. 6 to 8 years old should be able to express those things. But if they're using baby voices and being baby-like, that is also a sign of stress. 9 to 12 years. Intense anger, physical complaints, again, the somatic symptoms, trouble in school with their peers. So normally if the child is getting along with people and then all of a sudden something stressful happens and they don't know how to communicate what they're feeling, comes out behaviorally. Trouble in school with peers, yes. They blame other people for their behavior, so lack of responsibility, which is right in line with them developmentally. But it's excessive and just doesn't make a lot of sense to people that have, grown up already. Low self-esteem. That's a general age where self-esteem starts to kind of kick in and kids are trying to figure out who they are right before adolescence. High anxiety, drug and sexual experimentation. Yes, even that young, kids are starting to seek other things that are harmful to them, to deal with stress, even from a very young age. So, moving on to adolescence, and then we'll talk about anxiety, depression, and ADHD. The same problems can continue from years earlier. Promiscuity, like we just mentioned, addiction and or criminal activity. They may withdraw from friends and family. Overly shy or lack confidence. Chronic fatigue, difficulty concentrating, and a whole host of other things that come with the hormones of being an adolescent that we all have experienced if we're an adult watching. So those are just some of the signs of stress. Now, the overlapping symptoms is what I want to touch on. So I'm just going to highlight a few symptoms that overlap between all three diagnoses of ADHD, depression, and anxiety. So let's talk about irritability. My kid is, let's say I have a son and his name is Josh. Josh is 11. Josh has chores. Josh likes video games. And Josh tries to come home, avoid doing homework, and always has an attitude after school and just doesn't want to cooperate. Okay? I asked Joshua to do his chores before he gets on his game. And homework. Chores and homework. Joshua starts becoming verbally aggressive. And we're kind of taken aback, like, whoa, wait a minute. I'm the parent here. You're not gonna disrespect me. But Josh insists on being blatantly disrespectful, and you don't really know what to do about it. Irritability. Or your son's teacher calls and say Josh is not really doing his schoolwork in class, and when she asks him to do something, he has something smart to say, and it just is not in generally a good mood. Irritability can look that way for depression, anxiety, and ADHD. Let's talk about sleep disturbances / fatigue. My daughter Abby is 6. We just moved from Cincinnati, Ohio to Dallas, Texas. That was a lot. That was a huge move. She's having trouble making friends. She's not really expressive. She's kind of isolative, which is another thing that overlaps. And she is now sleepy all the time. She sleeps in class. Prior to the move, she was a straight A student, helped the teacher in all of her classes. From pre-K to kindergarten, she's now in the 1st grade. Now the move has affected her ability to function. And so she has just become almost lethargic, and you're just like, what happened to my child? What is going on? Also a very common symptom in between those 3 diagnoses. Aggression, kind of talked about that with the irritability a little bit, but let's go with the 14-year-old Isaiah. Isaiah has been suspended 4 times in the first 9 weeks of school so far. Isaiah has punched a teacher. Isaiah has vandalized the school property. Isaiah has also been suspended for getting into fights. And lastly, Isaiah has cursed out the principal. Now, where Isaiah gets his behaviors from beats you. You're the parents. You work all the time. Dad just left, and Isaiah, prior to Dad leaving, was also a straight A student. His grades were slipping. He's been aggressive also at home with you, most likely because he blames you for his dad leaving, because that is very common. However, the school counselor calls concern, and refers you to a counselor in the city, and after assessing, they gather that Isaiah is depressed due to the stressful situation about his father leaving. That one is more obvious, but again, aggression can happen with all 3 of those diagnoses. Hyperactivity. 6-year-old Sarah has difficulty concentrating, which is also common in all 3 diagnoses. She is disruptive in class. She can't complete tasks. She forgets to finish something when she started it and has gotten distracted. Her homework is often incomplete. Home life is almost perfect, and she just really has difficulty, and she gets in trouble a lot at school because of those disruptive behaviors, because of her inability to concentrate for long periods of time. So she's bouncing off the walls, and even in the grocery store and at home, she is like everywhere. You're shopping, hey, candy, hey, clothes, whatever. Mommy, can I have this? Daddy, can we buy that? Which is common in children in general. But a child, especially a small child with ADHD, they don't really know how to regulate everything. So that can be something. Now, we haven't talked too much about anxiety, but all of those things are indicative of one or more of those 3 diagnoses of anxiety, depression, and ADHD. Now, resources. If the problems are primarily at school, engage with the school counselor, have them give you some resources, or a school social worker may have outside resources like counseling agencies, group therapy sessions for kids with ADHD, tutoring that may be provided at school for our young people that struggle with ADHD or inattentiveness or hyperactivity. There's plenty of resources. Some states have agencies, like the one I work with, that offers mental health therapy in school. It's called school-based therapy, so you might want to look into that. Or take them to a counselor that can teach them coping skills, so that everyone's life is made easier. So coping skills is something that we can stay with and take with us for a long time. So those are just some of the things that we can do as parents to improve our overall quality of life, because having a child and we're not really sure what is going on with them, and we have professionals that can help us figure that out and help us all work together as a unit, you know, to enhance our life and decrease our stress levels, is super helpful, not just because I do it for a living, as we know, but it generally really is. Parents, if you do engage in counseling, please do not ever feel judged. I mean, you shouldn't feel judged by a counselor. If you do, you should probably look for a different one. But I'm saying, when we provide family with what we call psychoeducation, we provide different tips and exercises that families can do together with their children, so that everyone affected knows how to cope together. And then we provide the client themselves with coping skills to use. So please don't ever take that as a dig at your parenting style. It's really just something that can enhance your already present parenting style. So that's what I have to share today. I hope you all learned something. And if you have any questions that you need clarified, please drop them in the comments below. Don't forget to comment, like, and subscribe. And I'll catch you in the next video, Brainiacs.